I'm Missy Lee, and I'm with I'm with the Department of Children and Families, and I'm the Director of Substance Abuse and Mental Health in the Northwest Region. So we basically cover from Pensacola over to the other side of Tallahassee into Madison and Taylor counties. A lot of my staff is responsible for licensing, oversight, receiving facilities and things like that. That's not the reason that I took this job, because that's the boring part to me. I like the part where we're trying to build a true system of care, trying to improve services for families and give families a voice. And I'll tell you a little bit about how I got into that. But since there's only a few of us, I'm curious to know where some of you all are from. So, Crystal, you want to tell us who you are?
My name is Crystal Gary. I am Missy's assistant in the Northwest region.
But you also have a child.
I do. I have 3. My little boy has a few diagnoses. We've never had an autism diagnosis, but I am fairly certain we should have one. No.
Oh, okay. So
No.
sometimes they can.
He will be 11 this coming week. Sweetest thing ever. His diagnoses are, he has a behavioral diagnosis, but he also has a couple of medical diagnoses. And they haven't slowed him down though, like he's full speed. And he's a great kid, like he's amazing. So he's benefited. Today we went down to the exhibit room and the sensory room was like the most amazing thing ever. He went crazy in there. It was great.
Yeah.
So, anyway, I'm here to support Missy.
Thank you.
I'm Anne Marie Shelton. I'm a parent of 4 children, 2 of which have formal diagnosis of autism. And I'm a volunteer director and founder of Chipotle Autism.
Thank you.
I'm Cynthia Alvarez, and I'm a mother of 2 children on the autism spectrum, and I'm an ESC teacher, and with Anne-Marie, co-founder of Chipotle Area Autism Resource Center.
Thank you.
My name is Lane Anderson. I work as a parent ed specialist for Fiddler's East, which is Brevard and Volusia counties.
Okay, all right, thank you.
Hi, I'm Judy, and I'm lost.
Oh,
You are not lost.
You're supposed to be in here apparently,
Consider
Judy.
yourself found.
This is my second room. It's nice to be here, ladies.
Okay, thank you. So today we're going to talk a little bit about what a system of care is. And so a system of care is how a community takes care of its own. Basically, I had to have my aha moment. I came from the world of child welfare, and Judy didn't want to stay with us. So I came from child welfare, and so I did not quite get that a community can take care of its own, because I thought the professionals know all the answers. We know what's best for your family. So once I had my aha moment and I got into this the field of mental health and substance abuse, I realized that I needed to always ask myself, what would I want to happen if this were my family member? And so it really gave me a new way of looking, a fresh pair of eyes to look at how we're providing services to the families that we serve. And quite honestly, just adding on to that, now we are working at the Department of Children and Families. They have got us working on a project, priority of effort, where we've got our child welfare world working with our substance abuse and mental health world and in integration. And I work very well with our child welfare program manager, because I used to work for her. And so we really are making a true effort to try and integrate those 2 worlds. So my mission now is to educate the child protective investigators and the case managers that, I used to be in your shoes, so I understand, but you've got to take off these and put on a new pair of glasses and see the world in a different way, and realize that maybe it's a parent that has a substance abuse issue. Educating folks that people don't really wake up in the morning and say, I'm going to be addicted to drugs today and lose my children. There's usually something, a root cause for that. And we find that whether it be that there was child abuse when they were a child, maybe there was no abuse at all and there's a mental health issue going along with that. that substance abuse. So trying to get our investigators and our case managers to realize that there's usually something else going on. So really it's that stopping that quick judgment and stepping back and asking yourself, what would I do if this were my family member? So values of a system of care. We're strength-based, family-driven, and youth-guided, and truly we mean family-driven and youth-guided. A plan that we put together for a family is not going to work unless we have the family as the lead. Culturally and linguistically competent. Crystal and I know each other pretty well. Our families are similar, but she still has a different culture in her household than I do in mine. So realizing that we have to respect that everybody has a different culture even within their household. The example that stands out to me is that I have a friend who is Latino, and she tells me that people come to her door to knock on the door and they hear screaming inside and assume there's fighting. She's like, that's just our culture, we're loud, that's just how we are. I'm like, I've never thought about that people could come to a quick judgment on your family. So just simple as that, or and we're going to talk a little bit more about this, but maybe that person's culture does not allow them to say, hey, there's a mental health issue going on in our family. They can't come out and talk about that. Looking at community-based, evidence-based, and then outcome-oriented. So looking at our system of care partners, obviously the family is first. They need to be a true equal partner at the table. And then informal system partner means usually it's those free or unpaid services like a pastor or a teacher, guardian ad litem, neighbors, and extended family. And then a formal system partner are usually those paid resources, those paid system partners like a doctor, a counselor, case management, and other providers. What I want to express most about this slide is the faith-based community being part of that informal support system. Also, another passion of mine is bringing the faith-based community to the table. That used to be a no-no, that you didn't mix state and government and religion, and we're finding that, thankfully, those people that sit way above, that are never really out in the field seeing how things work, are realizing, hey, we've got all these churches, regardless of the religion, around. Why are we not taking advantage more of this? They want to help. They just don't know how to help. Usually it's in the way of giving financially, giving resources, but if our government would stop and take a step back and train folks, the churches have so much more to give than just finances. They have talents within the church that they could be sharing. So that is what we're going to talk about on the next slide. The faith-based community has a role at the table when it comes to providing services for our families. So a true system of care that's strength-based and recovery-oriented, which is giving people that hope that they can recover, and a culturally sound, will recognize the faith-based community is key. Our faith-based partners can help by allowing their congregation to get the training they need to be able to offer their talents to families. Maybe there's a family that comes to town who are not involved in a particular church, but if that particular church or mosque, whatever it might be, is willing to open their doors to this family and say, you know what, it doesn't matter what you believe, what your belief system is, we're willing to help you. Tell us how we can help you. So open table is a concept. I don't know if you've heard of it, but that's something that we recently brought to Northwest Florida. They actually spoke in Jackson County. Cost quite a bit of money to get it started, but I think it's something that we could do even without paying that all of that money, because I think churches are at a point where they're saying, what can we do to help? We know there's a problem. Mental health is growing, it's not going away. Substance abuse is growing, it's not going away. So what can we do as a church to help? All three sheriffs in the counties that we live in Northwest Florida, Holmes, Washington, Jackson, have said, we want to help reach into our community with our churches. And I've had a conversation with them and said, okay, if you have someone that moves to this community that's not of the normal religion that we're used to in our little southern towns, you have to still be willing. And they're like, we are. We're at a point where we know we as a community have got to start wrapping around people, and we want to help bring our churches along with us. So we're getting there, but it's just a matter, I think, of training our churches and our communities. In Panama City, Florida, the Muslim community has really stepped up and said, we want to help. What can we do to help? Small things like providing lunch at a conference that we had at FSU, things like that. So I believe that we're starting to get to a point where we truly are wrapping around, doesn't matter what religion you are, around families. So this is a way of our system of care that I keep talking about that we're trying to make communities aware, and that's through youth mental health first aid. And of course there's adult mental health first aid as well. So I became a certified trainer in both youth and adult, and it was probably the best thing that I ever could have done because it really, truly gives that general knowledge base. How many of you are CPR certified or ever have been? Okay, so it's the same thing except neck up. You know, I heard Patrick Kennedy talk about, you know, we always get the doctor to get checkups, but we never do checkup from the neck up, and it's just as important. So, in Northwest Florida, what we are doing right now is getting all of our frontline staff and first responders trained in mental health first aid so that they understand that there is a crisis going on. This is the signs and symptoms. What do I do to get this person through this crisis until they can get to a mental health professional? So that's one of the things also that I'm advocating for, is that all of our frontline staff and first responders. And honestly, recently, Calhoun County in Florida, 2 summers ago, we were able to certify every teacher in Calhoun County in mental health first aid. Yeah, it was really a great goal that we were able to meet. And now, in Panama City in Bay County, Florida, the school superintendent has said, okay, this is valuable, what can we do to help? Because there's so much bullying. I mean, I know that goes on all across the state, but that's one of the ways we're going to help with our bullying issue is through mental health first aid, getting teachers and, what do you call the assistant teacher? The aide, getting, paraprofessional, getting everyone trained in mental health first aid so they know to look for signs and symptoms and how to assist that young person. Because a lot of times when there's bullying, you've got depression, you've got anxiety that's going on. So mental health first aid is something we're going to be bringing to Northwest Florida, a train the trainer, so that we can get other folks trained to do this, because we're almost bombarded, we're overloaded, we just can't keep up with the demand, which is good. Yes, ma'am.
All of the fiddlers, parent ed specialists, and a lot of the school liaisons were trained last April.
And you're in the Northeast?
I'm in Brevard, Volusia, but
yes.
Whoever would be the parent ed specialist for your area.
Oh, yes, so it would be Rusty, right? Don't you guys think it would be Rusty in our area?
Is Rusty with,
He's
He's SEDNet, okay.
He's
So
talked about, the, mental health first aid.
Oh,
So I
yeah.
don't know if he's gone to a training.
Yeah,
Our
our
thing is
local,
that'd be another person to tap into.
Right.
as a resource.
yes. And actually, where our Fiddlers is at, in the Panhandle Area Education Consortium in our area, they actually partnered with us and purchased these books so that we could do this training. So you're right, and that's a very valuable resource. Okay. So looking at the parent caregiver involvement of system of care. And when I say system of care, I should have explained this at the beginning. About 5 years ago, the Department of Children and Families got a grant, a federal grant from SAMHSA. It was a 4-year grant at the time that had no money attached to it. It was basically intended to develop a system of care, to educate the communities on what evidence-based wraparound. Are you guys familiar with wraparound? Do you know wraparound?
I couldn't tell you what it is. We talked about it
Yeah.
some.
So evidence-based wraparound is pretty much what we're talking about with system of care, that the family is the lead, that you're truly wrapping around the family. It may be that a 11-year-old child was referred for services, but if we just provide services to that 11-year-old child, we've got this entire family, and we're sending this 11-year-old child back into the family who has no idea what they're supposed to be doing, how are they supposed to be coping with what's going on. So, for example, it may be that maybe this 11-year-old child was referred because they needed some pretty heavy counseling for whatever, maybe there was a trauma in the past. But they find out that mom does not have a job, or dad has got some issues with depression. So instead of just dealing with the 11-year-old's issues, you're wrapping around the entire family, and there's some money that comes along with Wraparound that will assist with dad getting the treatment he needs, maybe helping mom get a job, because the whole idea is, number one, you're holistically treating this family, you're thinking outside of the box, but more importantly to me is I had another aha moment. This family is not going to worry about bringing this 11-year-old to their treatment, whatever, if they have no idea how they're going to get food on the table that night, or if the electricity is cut off. Yes, or they have no transportation. And I think as a system, we've told people, okay, you need to be here at such and such time on such and such date. Never did we ask them, do you have childcare for your 2-year-old who is not going to sit quietly while mom and dad can listen? Or they don't even have transportation to get to this appointment. And then when they don't show up, okay, well, they failed, we're done with them. So Wraparound is, the philosophy is that the team doesn't fail, the plan fails. So if the team never fails and we've got an issue with our plan, that means that we need to step back and talk about why did mom not show up for this appointment, the caregiver, whoever, and let's help her deal with that. Not the, oh well, she was just being lazy laying on the couch. I don't think so. I just don't believe that. If she's going to try, is there a circumstance where maybe mom's laying on the couch, she doesn't care? Of course. Wraparound is not for every family, but that's basically what Wraparound is. We're truly wrapping around the entire family. So Wraparound is part of system of care, and then these other pieces we're talking about today are a part of it as well. So the parent caregiver testimony we're finding is the key, and that's where our peer support comes in. So we find that parents and caregivers can help fill in the gaps with what works to implement the changes. Maybe they need the professionals to talk to them about what services are available, but there's still those gaps that we need to fill in, and that's where the parent comes in. No one knows the family better than the family knows themselves. And then looking at community involvement, parents and caregivers are asked to get involved in supporting and recruiting and connecting families. That's why we're trying to build more support groups, not just we're going to meet once a month and sing Kumbaya. We're really going to get into, this is what works for our family, this is what doesn't work for our family, and offer tips to each other and truly be a support system. And that's where we have certified peer specialists come in, and we are in the Northwest region. I know they're doing this actually all over the state. We're offering trainings for folks to become certified peer specialists. And like I was mentioning before we started training with you guys, I just am in the process of hiring someone who has been to jail because he used to be addicted to drugs, and because he had some mental health issues because of trauma from his childhood. So the state now is looking at how can we get past these background checks. We work with a guy at headquarters who has also been to jail, but he now works for the state of Florida with DCF, passed a background check because we have the knowledge now to know that these people that we're trying to work with, these peers, have had issues in the past, and they may fall back into some of those same behaviors, and that's why it's important that the folks that are supervising certified peer specialists have the knowledge they need to offer that person support in their positions. So peer support specialist, which we also call peer support navigator. So looking at what is the system. I work for the state, and it is hard to navigate through some of the systems that we expect people to go through. I mean, we've got them going to 5 different places for services, and we're asking them the same questions at every single place that they go. So trying to navigate through the system. So we're looking at peer navigators being able to model and demonstrate that recovery is possible. A big push right now across the state of Florida is recovery-oriented system of care, so ROSC. And we've had summits all across the state of Florida in each of our 6 regions talking about the importance of giving people hope, letting them know that recovery is possible. So assisting persons to identify their personal interests, goals, strengths. I mean, what better for a person to know that there is hope than to empower them? That by sharing your story, you're not only assisting this person, empowering them, but you're empowering yourself as well. So encouraging individuals to meet their goals and needs by planning, coordinating, and working as a team. So a peer navigator is tasked with going with individuals or families to, whether it be an IEP or to court, whatever it might be, to make sure that they're not being ignored, that their story is being shared with others, and that they're able to hear that recovery is possible so that they can keep moving along where they need to go. So our responsibility and cultural competence, kind of touched on that a little bit before, but just knowing what families need, that families do have strengths. When I became a child protective investigator, they gave me a black and white picture, and I had to go through and circle all the negative things in this picture, whether it be that there was cigarettes on the coffee table in reach of a child, or the refrigerator's open and there's no food, that there's a knife on the kitchen table that the child can reach. We had to go through and circle all the negatives. Well, when I started working in system of care and wraparound, the picture that was put down in front of me was almost identical to the one I got as a CPI, but I had to go through and pick out the positives. So, one of the examples, mom is sitting on the couch smoking a cigarette. Well, that's mom's coping mechanism. I know that's hard to but if you think about it, mom has found a way to cope. Yes, there's a kitchen knife on the table, but she also was chopping up fresh lettuce to make a salad with. So, it's just going through. Dad was coming in the front door from work. He had a lunchbox with him, so dad is working, or whomever it might be. So it was just funny looking at it in two different ways, that now the system of care, we're looking at the positives, and every family has something positive we could pull out. It may be difficult, but a true system of care navigator, a peer navigator, will be able to help that family identify their positives, and it may be just one, but we can build from that. And remembering that things are not often as they appear. Like I said earlier, I had my aha moment. I don't believe that people inherently wake up and say, I'm going to lose my children today because of X, Y, and Z. Back when I was an investigator, I also had issue with domestic violence. I was one of those people who would say, I just want to shake her because she doesn't leave. I realize now that that was lack of knowledge on my part. Things are not always as they appear. My aha moment came from someone I was investigating when she said to me, I said to her, why didn't you leave? I was just at your house yesterday and look what happened last night. And she said to me, I love him. He's the father of my children. And I believed her. She genuinely was speaking from her heart. So things are not as they appear. To me, with what I was just looking at in my closed vision, all I saw was what was right in front of me. I didn't stop to peel back the layers of that onion to realize why she was staying. And once I realized that, I started helping her in a different way. I started helping her, empowering her, talking to her about positive relationships and such, instead of condemning her for staying. So don't judge. I'm different now, I promise. But professionals only have a snapshot of the child and the family, usually in an unnatural setting. Usually it's in an office, on a couch somewhere, which limits their understanding. So with system of care and wraparound, they're meeting the family where they're at. They're going into the home. If they don't feel comfortable there, they'll meet them at McDonald's, they'll meet them at the library, in the park, wherever is comfortable for that family. That's also something that we're having a hard time getting professionals to buy into, because, okay, I've got 1 hour, so you're gonna have to come to my office. So it's really thinking outside of the box. And that's where that billing and our headquarters in Tallahassee are trying to help us with getting our well cares and our, I can't even think, our Sunshine, our providers, to realize that there needs to be a different way for billing, and wraparound is one of the examples that we need to figure out how to bill differently for that. So we're working on that as a state. So we know that Florida has a rich diversity. Understanding culture is a piece of the system of care. So looking at child rearing, coping strategies, appropriateness of supports and services offered, and the expression of symptoms. Like I mentioned earlier, we've got folks who, a woman doesn't even want to make eye contact. She's relying on her husband to answer for her. And again, I just like sharing personal stories because for me it helps me relate if I hear that. When I was a case manager supervisor, I went with one of my staff to a home because she suspected that there was domestic violence. And when I sat on the couch with her listening, the wife would not answer our questions. She would look at the husband to answer questions. And I left there thinking, she's right, there probably is, you know. But once I stepped back and I collaborated with the counselor, the mental health professional, and we talked about it, we found out that her children had been taken away from her by DCF. She had only had negative interactions with DCF. Where do I work? DCF. She was scared to talk to me. And once I gained her trust and let her know, I'm not here to take your kids, I'm here to help you, she loosened up a little bit and she started talking to me. But if I wouldn't have started asking those questions, I would have walked away assuming something that wasn't really there. So just her expression of her symptoms were not what I was expecting. So just making sure that we realize that cultures, even within our own cultures, are still different. So some common themes of system of care and wraparound: that whatever it takes approach, thinking outside of the box, not doing the norm, not taking a case plan and scribbling the name off the top and just writing the next family's name, because not everything works for every family. So basically, whatever it takes, looking at different decisions, different things that are out there, different services for each family, family voice and choice, interagency collaboration, customized family team with individualized plans, inclusion of formal and informal supports, and that shared ownership and responsibility. So if you're looking at an example, just a very small example of what wraparound would look like, if we were having wraparound with a family, it would be the parents or caregivers. Maybe if they're involved in a church, it would be maybe the pastor. If they're involved with mental health counseling, perhaps the counselor will be there. Maybe Aunt Sally down the road keeps the kids while mom goes to the grocery store. Then let's bring Aunt Sally in. Maybe Jim down the road cuts the boys' hair because mom can't afford to go anywhere. Let's invite Jim, because Jim is part of that non-formal support system. So with wraparound, you're having everybody there that the family feels is part of their support system. So what is wraparound? Being familiar so you can advocate in your community. We want everyone to know that term wraparound so that they can start advocating for it. And I've already talked about all of this, but it's within and outside of formal human services systems while they remain in their neighborhoods and homes whenever possible. So that's the main goal of wraparound, is keeping kids and families where they're at and bringing the services to them instead of expecting them to go out and find them. So a crucial question for wraparound that we're asking the professionals to remember is, what do the members of this family really need to have better lives? And just asking that question, asking the family, what is it that you need to survive, but not just survive? What is it you need in your lives to be successful? Maybe it's something as simple as, I wish that my kids could be involved in sports. We can't afford it. Sometimes I found that that's the simple answer, and nobody's ever bothered to ask them that. Okay, well then how can we reach out to folks in the community and get together and get this family what they need? That's what wraparound is about. So it's truly like a family, and I've heard people actually refer to this as my wraparound family. Have you guys heard of a CAT team? Community action team that we work with our child welfare kids. So the state has given dollars for some of our service providers to have a CAT team, community action team, and there's only a couple in each region, but they mostly work with child welfare families, but they use the wraparound model when they're dealing with families. Listening and not judging, helping to bring important services and resources, ensuring everyone on the team is working toward the same goals. And with wraparound, everyone has a goal. When you leave your wraparound meeting, you have a goal, whether it's this week I'm going to sit down and talk to Susie for 5 minutes when normally we don't have time. It's making a commitment to set a goal, no matter how small it might seem, and everybody is responsible for their goal. And you leave with a date for your next meeting. And usually with wraparound, there's someone on the team that's available 24 hours in case there's a crisis.
Question for you.
Ma'am?
So how does this work if, say I'm part of a wraparound team for a family in my neighborhood, and I know that dad's got a drug addiction, or dad is selling drugs on the street. And we go in for the meeting, and the question is asked, what is your greatest need? You know, what is your greatest need for this family? And they say, to make sure that Jimmy gets in sports. So I mean, I'm sitting there thinking, but I'm standing there watching you sell, drugs out the front door.
Right.
My sense of what your greatest need is that
Mm-hmm.
you're going to have to go to jail and this family's gonna be without a dad.
Mm-hmm.
So how do you address the stuff that the family's not wanting to address?
Well, and we've had that issue before that we've talked about, and so a good wraparound facilitator is going to be able to navigate the family back to where they need to be, with that being the issue. Hopefully, if there is a substance abuse problem, DCF is involved, and if I don't think that they would probably be involved with the system with that going on without DCF involvement. So the DCF investigator, who may or not be present, because we've had that too. A family said, "I don't want the investigator here at my wraparound," and that's fine. But a good wraparound navigator or coordinator would be able to say to the family, "Okay, I understand you don't want him here, but we're all supposed to be going toward the same goal. And if you don't want him here, you're just delaying the treatment for your family. So let's just openly talk." And that's something at the very first meeting with Wraparound, is that the coordinator lays out the rules, but they let everyone know we're going to be very honest and we're going to talk about truly what the issues are. And you don't set too many goals that first meeting, maybe one or two. So let's just say the family says, "Oh, my kids need to be involved in sports." That's fine. But someone else at the table may bring up and say, that's a great goal, and give them that positive feedback, but then say, "Okay, well, we know that Dad has recently gotten arrested," and you don't say Dad either. So you say, "Mr. Smith you've recently gotten arrested for drugs. So what can we do as your team to help with that, to help keep you in the home?" And then also go towards we know that you have some charges, you may be going to jail, so what are some immediate goals we could set for your family in case you do go to jail? Almost like there's a safety plan involved with Wraparound, and they do cover that. It's a fine line, because you do want the family to feel that you want the family to be the lead on the plan, but sometimes that's when the Wraparound coordinator would say, "We need to lay this out on the table," but they would say it in a positive way and not a condemning way. We've actually had some of our child protective investigators come to training and have shared with them the importance of, you're going to have to leave your hat at the door and not be the investigator. You're here as part of this team, and if you can't do that, we don't want you to come. And that we've made it very clear to them, we're going to be honest and say, if you have to have your investigator hat on while you're in this meeting, you're not going to bring anything positive, and they're just going to walk away mad. We can't do that. So if that answers your question, and there may be families who don't want to deal with that, and they probably would not be good for Wraparound because they're not ready yet.
Mm-hmm.
Yeah.
Okay, thank you.
Good question though. I live in a dream world too, as you can tell. That's my hope, that we can get where we need to be. So looking at Wraparound, and kind of like I've been talking about, the family is always the center, but you've got to include schools, the home life, and the community in order to make Wraparound work. You're not going to be successful with Wraparound if you're just dealing with home and community. Where is a child at most of their day? They're at school. Mm-hmm. So if we don't start including the schools and the teachers and the counselors at school, it's not going to be successful. So we try and make sure with Wraparound there's a school representative at the table. So Wraparound allows the family to pick the services that are right for them, but having some guidance from the Wraparound coordinator. Wraparound removes pressure from the family and allows the agencies to bring support to them and wrap them. So taking off some of that pressure would be, we're not going to take your kids away. We want the kid to be safe, and we may have to do a safety plan. And that's why I say not every family would qualify for Wraparound, because sometimes there is a need to remove children from a home. But Wraparound is not just for families involved in the child welfare system. It is for any child who has behavioral health issues. Okay.
Sorry.
So benefits of Wraparound in our community, and I know you can read these, but success builds empowerment, opportunity for choices. Again, trying to get away from the cookie cutter model that, whether the only person you have involved in the system is maybe a counselor or a physician that you go see once a month, but making sure that they are part of the plan and it's not just a cookie cutter plan, that you're involving the school in that plan. Anne Marie, I'm just going to say this because I don't think you mind. I know that you have a child that has a diagnosis. So can you imagine sending that child to school and the school having no clue? A lot of times the school doesn't have a clue what to do or how to respond, but can you imagine the school not having any hands-on with what your plan is for your child? They're not going to be successful because they're with that child every day for 8 hours a day. So we've got to start including the schools. We've got to get physicians to start realizing that they can't just, okay, here you go, goodbye. They need to be part of the plan as well. Partnerships and inclusion builds trust and willingness for families to participate, and families learn to navigate complex systems. So just wrapping it up, when working with families, it's important to remember that each person and every family is a value and has a measure of worth. When we work with families, it's important to treat them with fairness, tolerance, and respect. And don't ever take a fence down until you know why it was put up. I did that for my own self because it reminds me to ask the questions. Why is this being done? It's okay to ask why. My boss had our leadership team read a book called Why, and I really realized that it is okay to ask why. Why are you doing this? Sometimes we find that because you bake a turkey in this one skillet in the oven that mom used and then grandma used, but we're thinking, there's an easier way to do this. Why don't we? Well, this is just how it's always been done. But there's an easier way to do it, but we always go back to the, well, we've always done it this way. And maybe if we realize why, we might know that there's another way of doing it, or maybe we don't want to mess with it at all. We have to talk to the family. Maybe it's their culture to cook the turkey in the oven this particular way, and that's okay. Maybe doing it the simple way isn't the answer. So just remembering that before we take the fence down, we ask why it was up in the first place. So that's system of care and wraparound. Hi.
Hey, I'm sorry. Cut the time and stuff.
Oh, no, you're fine. You're fine. So again, I didn't finish what I was saying about the system of care grant. So the state of Florida got the SAMHSA grant for 4 years, and we were able to apply for a new one when this last one was over for another 4 years, and this one came with service dollars. So every region, no matter where you live in the state of Florida, every region has a system of care. Not all of them got the SAMHSA grant. I think 4 of the 6 regions in the state got the SAMHSA grant. So we have some money this time where we can start building services in our communities, and one of the ways that I've decided to use that money is buying more wraparound, and not just for child welfare kids, any child, to really start getting folks trained in the communities. What is evidence-based wraparound? How can we start including that, whether it's a teacher at school that realizes there's an issue, anybody can make a referral for wraparound. It just, right now we're happen to be hopefully using AMI kids because they do deal with DJJ kids in the Northwest region. That's where I'm probably going to spend my dollars. I can't remember right now what my counterparts are doing, but I think most of them are buying wraparound with that funding, trying to get providers trained in wraparound so that they start using the wraparound model when dealing with families. Usually on a wraparound team, there's a peer support specialist so that they can be an advocate for the family. Right now, I'm just happen to be from the Panama City area, but Life Management Center is one of our mental health providers. They are getting their staff trained to use the wraparound model so that they can truly start wrapping around the family. There's incidental money for what we discussed earlier. If electricity is being cut off, we needed to handle that first. Before we expect them to show up for this meeting, we've got to figure out with the family, how are we going to get the electricity on? How are we going to get food on the table? Then we'll start talking about services for the family. So there's some incidental money that we're allowed to use with this new grant with System of Care. But the whole point is that in 4 years when the second grant's done, that it's sustainable in the communities. And that's going to be sustainable because of folks like you who, and I know you just walked in late, ma'am, but
It's okay.
where do you do? Are
I'm
you
a family advocate with a medically complex.
Okay. Where do you live?
In Jacksonville, Duval.
Okay, so let's see. So my counterpart over there is, her name is Jamie Carter. She's the Substance Abuse Mental Health Director with DCF, and they do have a grant just like what I'm talking about that we have. So fortunately, but we're going to be able to sustain this I just happen to know these guys up here. They live near me, these two. So some of the things that we're doing is going to be with parent training. We're going to have youth leadership. We're going to be empowering youth so that that next generation coming along is going to be able to help with offering hope, offering recovery as possible, and then with mental health first aid. That's another thing that we're going to be really pushing. I know you guys do over the Northeast region as well. So that system of care in a nutshell, what I would want you to walk away with today is that we need more peers. We need more people with lived experience to share their story of hope and recovery. And I think that we're going to see that our providers are going to be hiring peer specialists. We've got all kinds of training webinars for folks to get that peer training. How do you supervise a peer? How do you offer support for a peer? How do you get past the background screening for peers sometimes is an issue. So we've got all kinds of webinars that SAMHSA has put out because they've realized that peers can talk to someone better than I can. My diploma on the wall does not help me doodly squat when dealing with a family. That person with lived experience who, whether it be substance abuse or whether it be behavioral health issues, being able to talk to that person with lived experience is going to be more effective than anything I could say all day. So that's system of care in a nutshell. So you guys want to, yes ma'am.
So if I encounter a family who I know is already working with the Department of Children and Families, and they're struggling to pay their electric bill, can I say to them, ask about wraparound care?
They probably, whoever they're working with at DCF might not know how to get them that answer, but what they would need to do, I would recommend you telling them to call their substance abuse and mental health office at DCF. So if you got a family working with DCF, maybe in child welfare, if they ask their investigator, the investigator probably is not at a point yet where they're gonna be like, what? Wraparound what? So
Okay, call the substance abuse and mental health.
If you're in Duval, that's gonna be Jamie Carter.
What if I'm in Volusia or Brevard?
Yeah, she's down there.
Same.
Jamie Carter.
And you know what? Actually, let me give you this name. Evelyn Lynham.
Linum.
Lynam.
Lynam. The substance abuse and mental health counselor, is that what you said?
No, she's the director of substance abuse and mental health
Okay.
in your region. But Evelyn Lynham is the system of care coordinator, and she would be able to get them to someone that could help them. I'm trying to think. I can't remember who they're going to. Something youth services, not Capital City. Capital City Youth. No, that's in our area.
Yeah, that's Tallahassee.
What do you have? Some kind of youth services down there. I'm trying to remember. They're doing right.
East Coast.
No, there's something youth services in your area. I can't remember the name of it, but they would be able to work with that family whether they're involved in child welfare or not.
Okay.
Now the child has to have a severe behavioral health diagnosis. In my area, I'm fortunate I've got people who are don't care if they've got a diagnosis or not. They're so ready to get wraparound going that they'll just help a family whether they've got that diagnosis or not.
They have to have a severe what?
Behavioral health diagnosis.
Okay.
What are some of the severe behavior health diagnoses?
Autism we would count that, even though I know that's diagnosed differently.
Right.
But our SED kids, the reason you guys got called for that interview the other day is because those SED kids, severely emotionally disturbed, are some kids that that's who we're going to be looking at to provide wraparound for in the Northwest region, are those SED kids who might also be involved with DJJ. Maybe they're not. I'm really wanting to, we've got so many homeless youth in Tallahassee that also have a diagnosis and that they're just falling by the wayside. So we're going to be reaching out to Capital City Youth Services to help us.
There's other things going on that they're not catching that.
Yes. And they have no support system at all, and part of wraparound is helping someone build a support system. So you might have this 16-year-old kid who has no family, they're homeless. If you ask them who their support system is, they're going to tell you I have nobody. So it's our job as a community to help them build that support system. And we find that when we look at data, those recidivism rates are dropping, whether it be in child welfare system, through the DJJ system, whether it be SIP, placements, we're finding that if a family has wraparound, that those numbers are dropping lower and lower because they're using
Oh,
wraparound.
they're accessing services that they,
Yes.
we're not even aware were available.
And they're building a support system
Right.
so they don't have to keep going back to the system because their support system is this church down the street or Mr. Jim that lives on the corner that's willing to help, and they don't have to get a report called in on them because they didn't have food. So-and-so down the road will help them with that.
Well, and part of it is you see that it's like a hereditary thing almost, the issues that you have. Because my mom worked with DJJ years ago, and then she went in, when she retired from the state, into foster care assessments with life management. And some of the kids that she had as juveniles in DJJ were parents that were having their kids taken because they had issues, but when they were in DJJ, the grandparents who were their parents at the time, there was issues involved. So it was just a revolving door. And I see that with some of my EBD students at school. The families need so much. And like a kid that trying to get him to his counseling appointments, you know, we were trying to make it where the counselor could come to school, and some will, and that helps out because then the parents don't have to go pick them up. They rely on school buses to get them to school because they don't have a car.
Right.
So how are they supposed to get them to a counseling appointment? You know, so it's, you know, things like that. And seeing families, like you're saying, they have to buy into it. And I can see where there's some families that I have dealt with, if they had that, it would help them as a whole.
Yeah. And just what you just said, what time is it?
Just about 15 minutes.
Okay. Well, you just said two things. I don't want to forget them, but just remind me, acronyms and then the school bus. Okay, so I'll go back to the acronyms, the school bus. In youth mental health first aid, we talk about the signs and symptoms for things we see. And I know you're thinking this has nothing to do with what you said, but you made me think of something. You know, we put kids on school buses to go to sporting events who have anxiety issues, who, you know, and people are wondering, what happened? Well, you know, we talk about the different signs and symptoms. Maybe I'm scared of spiders, but if I see one, it's not going to require me to go to a hospital.
Right.
But it's still something I'm fearful of. So what you see my reaction to be is different than someone else's. So the school bus thing, when you said putting them on buses, it made me think that maybe the parents do or the caregivers do drop the child off for school because they have closed-in space issue. What's that called? Claustrophobia. But then we send them on the school bus to go, and the reaction, you know, we don't stop and think about how is this going to affect this child? Yes, why? So understanding those signs and symptoms as for something as simple as that, and then the acronym thing is another one that we're trying to push, a system of care. I'm not getting on to you for this, but I know you already know. So I had to learn that when we talk about navigating the system, I am sitting in meetings sometimes with my own coworkers and peers, and they're using acronyms, and I'm thinking,
What are you talking about?
what does
They're
that mean?
reciting the alphabet.
Yeah,
Yeah. And that's one thing I've learned to do, like in IEP meetings, because I learned that years ago. I can't remember where I worked at, something social work related, and talking about spelling it out. And I have a tendency sometimes to stop people in the IEP meetings that have been teaching forever, and I'm like, wait a minute, we need to tell them what that means.
But that's good that you do that. But think about, you're a professional, you don't mind saying that. Think about the parent who already is wondering, why am I sitting here? I come in and
Yeah, some of them don't even know what
They
IEP
don't.
means. They just know this is a meeting I go to every year for my kid. This is services they don't understand. What does that mean? Exactly. What is IEP? And I mean, yeah, because I can work one place like when I worked at ECF, you had, is it the FAA, the report we
the
had to do.
methodology.
FFA.
of-
Yeah, FFA, the new thing
Yeah.
they did. Okay, FFA I had been teaching. That's Future Farmers of America.
Oh.
You know, so you had two different things going on, and
Yes.
so I had to, you know,
Yeah.
see, I'm calling it FAA, so
Yeah.
all these acronyms.
Going back to your question of what were, you said, what were some of the severe behavioral health diagnoses? You said autism and SED, are there others?
Yeah, I mean, whatever you can think of.
Bipolar.
Yeah, anything,
Okay.
anything.
Yeah.
Depression, substance
They'll
abuse.
include ADHD and
Yep,
ADD.
yes, yeah.
And see, SED is now EBD in the school system,
What is EBD?
emotional behavioral disability.
Okay,
Yeah.
okay. That's what I need
You
to.
said
Just-
bipolar, depression, you said
It's a-
ADHD?
ADD, ADHD.
Yeah, anxiety
Basically,
disorder.
Anxiety would be
any
on one you
sort
see
of
nowadays.
behavioral issue,
Yes.
they can classify it as severe.
Okay.
depending on,
And so that's like what she was talking about with autism,
Oh,
sometimes
it affects them.
it's a
Right.
neurological, neurodevelopmental, it's a developmental disability, neurological, behavioral, it can fit under many
Yes,
titles.
wears many hats.
yes,
Yes.
yeah.
And I think you were the first one that made me start thinking about it. So if you don't think you made an impact on people, think about this. I always think of autism as a neurological
Mhm.
disorder, and
Mhm.
almost took offense when people referred to it as a mental
Uh-huh,
health issue.
uh-huh.
But then when you really think about it in the grand scheme of things,
Mhm.
it's in the DSM.
Things that go along with it.
Right,
Yes.
and all the comorbid
Yes.
symptoms of it, and I'm
Yeah.
like, I get what she's saying now, I'm gonna think about this in a different way,
Yeah.
it's not.
So I totally offended you at first, and
No,
then
you
you started
did
liking me, and I was fine.
never offended me, no, but you always heard that, everybody always
Yeah.
said, but
Yeah.
you were the first one that whatever we were discussing
Uh-huh.
went far enough for me to make the connection. Like, okay, I get what she's saying now, and so I don't think about it, it's not us against them, it's not like we're a
Yes.
tribe that only,
Yes.
it's.
Yes.
We're
a lot
trying
of-
to make
Yes.
people not
Yes.
look at mental health issues, and I don't like saying issue, but
Uh-huh.
instead of looking at mental health as a bad thing, everybody, it's
It's
always
our
been so
neurology.
quiet and
Mhm.
closed off, and
Mhm.
well, they have mental health problems, we're trying to make people stop
And
looking
the
at
last
it that way.
one with NAMI that we've said in on, they were talking about schizophrenia, and when you're talking about the symptoms of schizophrenia
Mhm.
and bipolar, and then you think about the same cluster of symptoms that a child with autism has,
Mhm.
and we have a unique experience with our 4-H endeavors. We have a child who was diagnosed autistic,
Uh-huh.
she has autism,
Uh-huh.
but she's now been diagnosed as schizoaffective,
Schizoaffective.
which is a combination now we learned today of
Uh-huh.
schizophrenia and bipolar.
Uh-huh.
Because when she's describing symptoms, it's like, well, my kid gets that, but he's scripting it from something
Right.
he's watched or read, and she's
Mm.
experiencing
Mhm.
this, and we
Mhm.
kind of wondered, is it
Is it autism,
Is
or
it-
is it?
Yeah.
features of her autism, or, but getting it clear that it's our brain, our
Right.
brain is.
Right.
And that's why you gotta have
It
a
is very
collaborative effort.
Yeah.
Yes.
Have you
Yes.
guys met Dr. Summer who's here?
No.
Oh my gosh, meet him before you go, he will blow your mind. He's doing genetic research, and his company, he's isolated the exomes for autism, and all of those things are related in the brain, I mean.
Yeah, because it's amazing. I worked with
Oh my
adults with
gosh.
developmental disabilities that
Mhm.
50 years ago
Uh-huh.
were diagnosed with childhood schizophrenia.
Stop by his thing, he's in 704,
Okay.
he med, oh my gosh.
And
Oh my.
then, so it's interesting now they've gone back,
Yeah.
the more they know, and they've
Yeah.
diagnosed her with Fragile X and autism
Uh-huh.
and.
Because back then you didn't have a
What is
genetic
open
test for
table?
Fragile X, so.
Open Table started in Arkansas. There's one in Florida, and that is in Orange County. Orange County has Open Table. We brought the founder, John Cato, down to Northwest Florida, and he did a presentation on Open Table. And it's basically, when I'm talking about the culture and bringing the churches involved, no matter what religion, that's Open Table. Is the actual congregation will be trained to have a table where someone can learn from the congregants.
Mhm.
Is that what you say?
Church members, yeah.
Okay.
Yeah.
Well,
Congregation, I don't
the
know.
congregation, so people can learn from them different life skills, how to open a business or this and that. So basically, Open Table educates the congregation on how to hold tables for folks who might be having some issues, and especially dealing with homelessness. It helps them get to a point where they're stable, and they can then build their own support system with the congregation's help, so that they get themselves to a point where they're not homeless, they're
Productive.
You're giving them the
productive.
skills they
Yes,
need.
yeah, you're giving them the
Everyone
skills they
in
need.
the
Yes.
congregation or whoever they bring to their table has a different skill that they bring.
Yes.
It's really great, like if you ever have the opportunity
Yeah, I missed that. I was-
it was so awesome.
It's like $30,000 to
35.
bring 35 to bring the training to an area. They promised that we could be their first rural area in the state state of Florida, but now I've got to get people on board that are willing to help pay the fee so they can train different churches, or mosques or whatever religion it is, to train them to have tables at their place of worship so that they can help people.
Is the idea that you bring together multiple churches within the community?
Yes.
Yes, and some churches do that. Some communities have tables where you have different folks from different churches come to the table with different skill sets.
Mhm.
But now some churches are choosing to do it within their church, so they have enough folks in their congregation that they have their own tables in their own churches, and it's a big commitment because you're committing
Yeah.
to this is a stranger basically that you're committing to meeting with them maybe once a week, maybe once every 2 weeks, and continue doing it for about 6 months.
Do you know who in Orange County did it?
Anne Marie Shelton,
No.
No.
that's you.
No, Anne Marie.
I'm about to say,
Anne
what you
Marie.
been doing?
Anne Marie, if you look up Orange County System, sorry, I'm looking at you, Anne Marie Sheldon. If you look up Orange County System of Care, the lady's name is Anne Marie, and I can't remember her last name, but they've got it going somehow through their system of care.
It's huge. They have a lot of county support. With their local government has funded a lot of stuff for them. They have their own sales tax within their county that they've used to fund their system.
Yeah, it's amazing down
Yes.
there. Millions of dollars going into Wraparound
Yes.
down there. And I'll give you this. This is an old brochure. We haven't had our new ones made yet, but it's got my contact information on the back and kind of gives just a little summary of what system of care and Wraparound is. So thank y'all very much. If you have any other questions, please let me know. If you know of someone that wants to get training in mental health first aid, even if they're from you guys' area in a different region,
When are y'all gonna offer that again?
it's going to be in the fall. We're working on it. It's cost about $30,000, but
And that's
we're
a train the trainer?
train the trainer. And I don't mind Jamie Carter from Samson, like if you called me and said, hey, we want to send someone, I don't mind calling Jamie and saying, hey, there's someone from your community that wants to be a train the trainer, and she'll pitch in some money, I'm sure, and let
But you
someone
need to
come.
take the regular courses.
You have to be trained, yeah, you have to go the regular course
That's
first.
Yeah,
And you can look that up on the internet, on mental health first aid, they'll tell you where the closest one is to you. But you can look on mentalhealthfirstaid.com and it'll tell you in Florida where the closest training is. Go get certified as a youth mental health first aider,
Yeah.
and then you can go to train the trainer.
And
I
do you know
mean-
when it's gonna be?
It'll be in the fall, I'm not really sure yet, we're trying to collaborate and blend funding right now.
And it's gonna be based where?
We're gonna have it probably in Panama City.
But it's beautiful. It's beautiful
Yeah.
there. It'd be a really
Yeah.
good reason to come for vacation for a little while.
So mentalhealthfirstaid.com?
Yeah, I can't remember exactly what the website is.
It is
but
the National Center for Mental Health, something like
National
that.
Council.
National Council.
Something, but if you
Yes.
just Google mental health first aid, you'll find the
Yeah, because you
website.
sent me one, it was like the next day, I'm like, I can't come tomorrow, but I need to do that one.
Do you want to go now? I mean, do you want to
Like
go?
today? Yeah.
No. Do you want to get the training
I wanna do I haven't done either youth or.
next
adult.
Friday
Okay.
in Mariana?
Oh,
We're doing it for adult protective investigators, but you can come if you want.
Okay.
Cool.
Where's it gonna be at?
At I think it's at Big Bend Community Based
I'll
Care in
email you.
Mariana. Yeah.
I'm interested in that
You
too.
can come and it'll be free.
Okay.
So
You don't
I
have
would
to
look
work
and see
next
where the
week?
closest one is to you guys in your
I've
area.
done it, like I said,
Okay.
I did it through the Fiddlers.
Okay.
You've done adult and youth both?
No, I've done youth.
It's okay, as long as you're certified in one,
Yeah,
then you can become a train the trainer in youth mental health first aid.
right.
But I would try to find an adult. I mean, they're adding to it now. They've got for law enforcement, for military. I'm going to get certified in both of those. I'm a veteran, so I can get certified to teach other veterans. So yeah, lots of stuff going on. But we're constantly looking for partners, and I know that Jamie and them too are over in Duval and such. So I'll brag over. You guys come from an area where you're just in pretty much in the same place as us. It's very passionate in those two regions. We have 6 regions that DCF covers in the state of Florida. The Northwest region and the Northeast region are always leading the pack in system of care and trying to build services. May not seem like it, but really we are. Really we are. So.
I'm so encouraged to hear that you've reached out to the church communities.
Oh,
Because
good.
it just
We're
doesn't
trying.
make sense to,
I know.
yeah.
It's one of those things where why haven't we already done this?
You've got to look up the open table.
Yeah.
I will.
Yeah.
Open
It's
table is
interesting
the
'cause all
best
of
thing.
this, in my first semester of my master's program, I had to they gave me the hard class first because I was scared to do it. She said, you take this one and you get it, you got it.
Yeah.
So I took that class, and the whole culminating project was a Bronson Road project, where you went and you looked at everything that, you know,
All the puzzle
the
pieces.
system of care.
Yeah, yeah.
Basically,
Yes.
everything that was going on. And so I told the instructor, I said, I want to do autism in the rural community,
Mm-hmm.
and on a bulletin board. And then he's like, well, I really, this is for everybody to see, you know, and I really wouldn't do it. It's too much. You could
Mhm.
do it, but I wouldn't do it. And so I went into this whole dissertation as to why
Mm-hmm.
I wanted to do it. And he's like, okay, you won me over, do it.
Mm-hmm.
I'm like, oh, great, now, you know. I got like a 98 on that
Yeah.
paper. And
Probably educated him some.
yeah,
Yeah,
so it was
sure.
really interesting.
Yeah, 'cause
But it's similar. I get
in
the
our area.
Yeah.
correlation.
What table is Dr. Sullivan at?
Oh my gosh.
Thank y'all.
You know the table?